Exercise is great, but the thought of it is great, but not fully interfering.
Feeling I'm going to tread if I put a mirror. It looks like a baby's head coming down.
Oh.
My sister passed away this last Wednesday. The cancer.
Oh, gosh.
I'm scared now.
You be careful, or are you doing that on purpose now?
Oh. Deloya.
GPs up and down the country are struggling with the workload. It's a really good opportunity to be part of the NHS in Birmingham.
First time in Birmingham?
Yeah, it's lovely here though, isn't it?
Yeah, to see a new system and to be able to help out.
The GP's mobile surgery being connected to the Oaks Medical Centre has been really helpful for them.
All patients and communities are unique, so there's no one patient that you would see here that you wouldn't see somewhere else. And that's just a real joy about general practice anyway.
Daniel.
Yes.
Hello,
Hi
come on
there.
in. Have a seat there for me.
Yes, thank you.
How's your day going?
Okay, so far.
Yeah?
Yeah.
Good. All right, well, tell me what's brought you in.
So, I think it was about July. I started having nosebleeds. Started a new job, which was more computer-based. So at first I thought I'd just put it down to that. They have given me some tablets, but the nosebleeds are still happening.
Okay.
The recent one being this morning.
Nosebleeds in themselves are very common. Lots of people get them, and the vast majority of the time they're not linked to anything serious. But then in those very rare cases, there's a problem within his blood and its ability to clot, and therefore would make him more prone to bleeding. Tell me a bit more about nosebleeds. What tends to bring them on?
It can be anything. This morning I was just sitting watching the TV.
And have you noticed, is it always one nostril in particular?
It's always the left
Always
nostril.
the left one. Once the bleeding has stopped, are you doing anything else to your nose? Are you blowing it? Are you trying to get clots out? Not sticking your finger up there? I need to have a look up your nose. That's all right. The one thing I should always ask about, I sometimes forget to, are you using anything else up your nose, such as cocaine or any other kind of illicit drugs? All right, good. I might ask you to pop your glasses off. That'll just make it a little bit easier. Because what I'm going to do, I just need you to keep your head right there for me. So I can see exactly where the blood's coming from, which is great.
Yeah.
All right. The little bone in the middle of our nose is called the nasal septum.
Yeah.
And there's lots of little blood vessels that basically sort of run along its surface. And
Okay.
they all meet at a little point just inside the nose called Little's area. And that's basically where you've been bleeding from. There's a tiny little point. And I can see the little blood blister, just the little scab that's formed just there. Sometimes when we get a bit of a bleed from there, it can sort of recurrently bleed, and that's basically what's going on here. So we just need to try and help that heal and settle down. So there's an ointment that we can use called Nosebleed.
I know they gave me some cream to put up my nose.
Ah, right, OK, let me have a look.
Don't ask me what it was called.
Yes, so after you used that in the middle of July, do you think it helped for any period of time?
It was great, but then as soon as I stopped,
OK.
it started again.
Fine, OK. So there's Plan B. Plan B is to use something called silver nitrate. It comes in a little pencil, and we basically put it on the point where it's bleeding. Okay. And that basically, it actually creates a chemical burn. Sounds painful, but it's not.
Okay.
It causes no pain at all. But basically like cauterising a wound, essentially. Yeah. Usually use it to treat verrucas, but we're going to do it, use it to treat nosebleeds, don't worry. The pharmacist doesn't have it in stock now. He can order it in. Okay. And so basically, if you can come back to us on Friday, bring it in here and I will do it for you.
Brilliant.
Brilliant.
Cheers,
all
thank
right,
you so
see you
much.
Friday.
Take care.
Bye-bye.
Hi, is it Dexter?
Hi,
come on through. I understand I've got 3 of you today.
Yeah.
Fantastic, come on in. Dexter, you take the hot seat. You're the patient. Thank you. How can I help today?
Well, basically, I've just I had COVID like ages ago when it was still kind of a thing.
No, it was in July. You had it 3 times, remember?
And after that, when I've been testing negative, I don't have it anymore. I've still been getting the symptoms, so I've still got a headache now. I've had it every day since I'm feeling sick, feeling tired, nausea,
He hasn't been right since he's had COVID.
And that was July?
Yeah, July.
And you mentioned it was the third time you've had it. It was in July.
Yeah.
And did you have any of this after the first or the second time?
Not really.
Every night he's asking for paracetamol and it's not sitting right with me now because I don't want him to just keep popping paracetamol. But and you can see it in his eyes, and then sometimes his headache's that bad, he feels really, really sick, and he's heaving and stuff. It's just doesn't seem right.
Can't sleep very well as well.
Yeah,
because of that.
Because
Because
on
of
his head sometimes, like there.
And the pain that you have in your head at the moment, can you point to exactly where it is? Okay. And what does it feel like? Is it sharp, thumping?
It's like,
use your own words.
it's like it comes and it goes for a second, then it comes back, goes for a second, like throbbing.
Does it affect your vision, what you can see?
Sometimes in school I don't have a clue what it says on the board. But
And you mentioned heaving. Have you vomited at all with it?
A couple of times when his headache. I'd say about 8:30, 9 o'clock, his headache gets really sort of intense sometimes, don't it? And he feels really sick. I mean, I thought, is he run down so he had vitamins? I'm making sure he drinks enough. And he's just not really been himself since he's had COVID.
The sort of starting point for me is that this isn't normal. We don't expect for you to get headaches and feel tired all the time when you're 12. It could be related to COVID, it could be something else, but we definitely need to look into it. You've done the right thing by bringing him in.
I've had a cough for 4 or 5 weeks, just can't get rid of.
I've had a cough for 3 weeks now.
So you've had a sore throat now for 6 weeks plus?
Yeah.
And I know you had a COVID test.
It was negative.
Of course, with COVID, they haven't had face-to-face, they've not seen us.
I see you most recently had your COVID booster vaccination and you also had your flu vaccine.
Have you had COVID before?
No.
Okay, and have you had vaccinations?
I've had all my vaccinations.
Okay.
Are you up to date with all your vaccinations and things? The COVID,
I ain't
the
having
flu?
them.
No?
No.
Why not?
I don't want them. I ain't putting that rubbish in me. No
You're
chance.
at high risk.
I don't care.
COVID has a lot to answer for, I'm afraid.
Did you ever have any breathing issues at all when you had COVID?
Not when I had COVID, but when I was like quite young, like 6, 7, I had asthma.
Okay. But you've grown out of that now?
He had baby asthma, yeah.
Okay. What I'd like to do today is examine you. Let's put this on here for now. So this is just checking your oxygen levels. Top marks. I do want to have a look in the back of your eyes. I'm going to turn the lights off. All right. That looks really healthy and normal, which is good. The purpose of that test, which is not very nice, is it's really reassuring to see that there's no build-up of pressure in the nerve behind the eye that we sometimes see if there's something more worrying going on inside the head. So we definitely need to do some blood tests to see why you're tired, checking things like iron, anemia, thyroid problems. We call this long COVID, if this is what it is. Then any symptoms that persist after you've had the COVID infection, and we do see it in children, and there may well be some specific pathways to investigate that, but daily headaches in kids we take seriously, so it may be as part of that conversation we think about what tests might be needed.
Yeah.
One question I have is, since July, would you say that things are just the same every day, getting worse or getting better?
Well, I think it depends on a lot of what he's done in the day. If he's done a lot of activity, football and that, you seem to get a bad headache that night, don't you?
That does fit more with the long COVID picture, because we see that on days where people push it, you know, and are particularly active, that makes them more tired. I would say be really cautious about overdoing it, because it must feel so frustrating to not be your normal self, and on a day you feel a bit better, you probably want to run out and do all the things you would normally do, and actually we sort of see a bit of a boom and bust effect in people. It's better to pace and say, okay, I feel better today, I'm going to do 10% more than I was doing before, and then the next day just building things up gradually. We'll get some bloods done and possibly some more tests, but I'm going to first have a conversation with the paediatrician, and then I'll either ring you back later today if I can get that conversation in today. If not, it'll be tomorrow. In the meantime, if you have got a headache, it is okay to take paracetamol. And I wouldn't expect things to get worse. So if you notice that you're more, you start vomiting, you notice anything weird and wonderful like falling over or numbness or weakness on one side or problems with your vision, anything like that, I want you to seek urgent medical attention if that were to happen.
You're right then, mate. Shall we go?
Yeah.
Okay, we'll sort it
Thanks
out.
for coming in.
Thank you.
All right.
Come on, Shugs.
Take care.
See ya. Thank
All
you.
right.
She's anxious to get in there.
I know.
I get it.
Delilah Brufkin, please. Hi there.
We're going.
Hiya. Come on
yeah.
through. Hello. All right. Hello, hello. And what relationship are you to Delilah?
I'm a nan.
You're a nan. Great. And how can I help today? What's been going on?
She keeps getting a rash around her mouth and her eyes, and I think she's got ear infection. She keeps holding this ear
Is she?
and crying when she holds it.
Yeah. And how long has she been doing that for?
A couple of days
Yeah.
now.
But the rash is
has been
different from that.
Yeah, the rash has been ongoing. But we thought it might be dribble rash.
Right.
But now it keeps coming under her eyes.
Okay, so I'll have a little look at that. But that's been going on for more like 3 or 4 weeks, has it?
Yeah.
And then the earache just the last couple of days. Yeah. Hello. You can have a run around, can't you? So, has she had a fever or been unwell?
She does throw up now and then, but it's not all the time.
Okay. And she hasn't had a runny nose or anything
Yes,
else?
she has. She has had a blocked nose. She's getting over it now.
Go and sit on Nan's lap. So what I'm going to do is just have a look in the bad ear. We'll take her temperature. That's it. And I'll just have a little look. It's all right, Poppy. Well done. Just keep her really still for a second. Well done. I'm sorry. Well done. There we are. It's quite tricky. Let's try the other one and we'll just check this one as well.
Martin Campbell, hello there.
Thank you.
Come through and have a seat. How are you?
Okay-ish. I mean, I'm taking the blood pressure tablets. I'm taking the folic acid. But I just feel so... as if I've got no energy. Just down, you know?
Are you feeling depressed, do you think?
No, I don't think I'm depressed. No, I don't think it's depression.
How long have you been feeling down for?
It must be a few months now. I mean...
Is there anything that you think is going on? Anything stressful?
Well, I'm looking to move.
Okay.
So, which is driving me mad at the moment. Because I'm travelling to Suffolk, 3 hours there, 3 hours back.
It's quite a long drive.
Doing viewings, and I bid on one, was the highest bidder, I didn't get it. No, it is what it is, but, you know.
That's disappointing, though. Is it on your mind, moving?
I've sold my house.
Right.
And the person's not going to want to wait forever while I try and find somewhere, so it is pushing me along a little bit.
Right, there is a bit of urgency there to try and get somewhere. Okay.
But,
are you sleeping okay?
I want to sleep more than ever. This morning, when I woke up, set the alarm, I don't want to get up.
Okay.
And that's never been me.
Right.
Never in my life has that been me. It's always been an alarm, out of bed, go to work or whatever.
Okay.
Yeah, the rash comes round her face and then her eyes like comes and goes. It's weird.
Yeah. If we're all done, you could pop her down if she would be a bit calmer.
There you go. Go on then.
It's all done.
Go on
sorry.
Then. What's that?
So, the first thing is that this rash looks like a little bit of eczema. It's quite dry and it's going to get better with a little bit of steroid cream.
Yeah.
And I'm going to give you some of that, plus some moisturiser. And then if it doesn't settle down or it gets worse, then we better... So you
she didn't see that.
into the glass. That's no good, is it?
Come on, you silly sausage.
That's no good, is it? And in terms of what I can see in her ear, it's just a bit pink in there, and I think that she has got some ear pain, but I don't think there's anything that some antibiotics will help.
Oh, okay.
All right, and obviously if she gets feverish or she stops eating and drinking like normal, or she stops peeing, then that would be a worrying sign. But my suspicion is that if we leave it a few more days, it's all going to get better. So just carry on the calpol.
Okay.
All right. You be careful, or are you doing that on purpose, Nat?
Oh, Delilah.
I shouldn't laugh, but it was quite funny.
Are there still things you look forward to?
Yeah, I look forward to seeing my children and my grandchildren, but I've just lost my brother to... I lost my brother and my sister to pancreatic cancer.
Oh, goodness.
So my brother not long ago, but to watch him in pain for
That's awful.
for quite a while was, he just kept saying to me, I just want to end it, Mark. He said, I've had enough.
When was this? When did he pass away? When did he have a diagnosis?
Oh, he had the diagnosis over a year ago. He passed away in June.
That's quite recent as well, isn't it?
Yeah, my sister must have been about 12, 13 years ago.
Do you have any other siblings? No. Okay.
No. I'm the last of the Campbell clan.
Oh.
Well, in a way I am and I'm not. My daughter's a Campbell, obviously. She married a Campbell. So I've got 4 grandchildren.
So to me it sounds like you have a lot to look forward to, but it's really when you finally get to the place you're going to move to. And at the moment you're feeling quite low and it's being here. So I think there is an element of low mood and and depression here as well. I think, you know, it's hard for us to know exactly when you're going to move, but we need to look after you as well as we can while you're here with us. And the sorts of things available are counselling, talking therapies. If you would find that helpful, we can refer you to that, or also antidepressants.
If I got that far down, I've got the sense to come and seek advice and, you know.
Yeah. Do you mean that you never feel so low that you want to harm yourself or end your life?
No.
Okay.
No.
Okay. I mean, sometimes it just helps to come in and have a chat with one of the doctors, so do that if that's helpful.
Yeah.
And anything else you wanted to ask me today?
If you could take me back 30 years would be nice.
Good morning. Hi, how are you?
Could be better.
Okay, that's what we're here for. I believe you're here to see Dr. Ferdinand, is that correct?
Okay.
Brilliant. If you'd like to just take a seat.
Thank you very much.
Have you had a busy morning?
No, not at all.
No, that's good.
No, I'm having problems with my back at the minute, so I can't
Oh no.
do anything.
Yeah.
It's all happened since that car accident, but
Oh dear.
truck went into the back of us. Yeah, I can still see him coming up in the mirror. After 3 weeks, I thought I was okay, and I went back to work.
Yeah.
And then 6 months later, it all went really bad again, my back.
Yeah.
And I said, it's due to the accident. And, oh, great.
Oh no.
And I've not been to work since.
Hello, Mr. Haynes.
Hello, sir.
Hello, I'm Dr. Ferdinand. Come on in, please.
Okay.
Have a seat there for me.
Thank you.
How are you doing today?
Struggling.
Struggling?
I am.
Sorry to hear that.
Okay. I've got this back problem. It's been going on now for about 5 years. And I've got to have injections in my spine tomorrow at the hospital.
Okay.
I've had them before, and it didn't make it any difference at all.
Right.
But I'm willing to give it another go, but I'm still struggling with my back. The other thing is now I've got palpitations as well.
Yeah.
I am taking some medication for that.
Yeah.
Basically, I want to know whereabouts I am with all my health issues, because not going to work now for 5 years is a bit of a downer, to say the least.
Absolutely. I really felt for John. He very clearly explained how he had back pain and how that was really limiting his mobility and really having a major impact on his quality of life.
The drugs that they sometimes give me when I have my back problems, I feel like a zombie when I'm having the tablets.
Okay.
It's great, it works. It only works because it wants me to go to sleep.
Mm.
Go to sleep, you feel no pain, that's brilliant. But I'm sleeping my life away.
Welcome to the mobile surgery.
Hello.
How are you?
Apart from my bad back, I'm fine.
I have very severe back pain.
Where is the pain that you get?
Lower part of my back.
Fed up of being in pain.
During the day, I'm trying to walk about round and I can't do it.
I mean, I know what to do with my back because I've had it before.
So you asked me about swimming. I think swimming is brilliant, very good for your back.
Yet no two back pains are ever the same.
No, keep that appointment because there's no harm in having physio at this stage.
I never get bored of seeing back pain.
No.
It is a funny thing, isn't it?
But I am struggling again now today.
Yeah, I'm sorry. You've clearly got quite a few things going on. You mentioned you've not worked for 5 years. What sort of work did you used to do?
Truck driver.
Truck driver, okay.
Yeah. There's no way I could lug the stuff around on the back of a truck anymore. I can't really do anything. I mean, I sure even get my socks on.
So it's a lower back pain issue,
Yeah.
is it? That you get?
I think they said it's me 1, 2 and number 5 vertebrae.
Yeah, okay.
And I think they said it's, are they called deteriorating?
Yes, degeneration.
But the pain is just rubbish.
Okay, fine.
It goes, oh, it was going right the way down the back of the leg, but it's also going down the side of my leg now, at the front.
So you've not really found a medication that's kind of managing this, obviously.
No.
That's why you're at the point where you're about to have his injections again.
Yeah.
What about other things such as sort of more lifestyle-related things? So things about exercise, physiotherapy, weight loss.
Look, I have problems getting out of bed, let alone
Yeah.
trying to do exercise sometimes.
Yeah. Mm.
Exercise is great, but the thought of it is great, but not put it into theory.
I suppose the thing about physiotherapy is that the exercises are going to be very gentle, very simple, things you can do even lying in your bed. Because fundamentally, along with the degeneration and the problems that are obviously there in your back, strengthening the muscles in the back is really important in kind of helping the back to function without it causing you pain. So I think it's just something worth maybe thinking about again, okay? So then the other side of that coin is the weight loss. So is that something which you feel that you maybe have more confidence in being able to address?
Yeah, I could lose weight, but doesn't that include exercise as well?
Not always. There's a saying that managing your weight is 80% in the kitchen and only 20% in the gym. So it's far more about what you eat.
I felt happy as I was, to be fair, but then I suppose that makes sense.
I mean,
Pushing down
certainly
on the back.
Well, absolutely, but certainly in terms of the back pain, I can assure you that losing weight will be beneficial to that. And then also in relation to these palpitations and the heart issues you're experiencing at the moment, again, weight loss will help with that as well.
Okay.
Yeah.
Well, I'm glad I've had this chat because I've not been able to really talk to anybody. All I've had is, you have to take these tablets, and I'm going, well, why have I got to take these tablets?
Can we just take a moment and just check your blood pressure, because that's something I think we need to do today.
Sure.
Blood pressure is a little bit high at the moment. When we're thinking about your heart, getting certain things getting certain risk factors under control is really important.
For him, his blood pressure wasn't causing him a problem. He has no symptoms of that. But the problem is, if I ignore that problem, even if I solve his back, he could be developing bigger problems like strokes or heart attacks 5-10 years from now, and then his quality of life would drop again. So it was really important I address both problems and not just focus on the back.
The tablet that you've been put on is very much designed to slow your heart down, stop you getting these palpitations. It will have a tiny minor effect on your blood pressure, but not a massive one.
Okay.
There are some tablets which are much more effective at getting your blood pressure down. We could even start one of those today to try and get things better controlled in terms of your blood pressure. How would you feel about that?
Okay, something else. Go on.
Yeah, we're throwing a lot at you today, aren't we, John? I'm going to do the prescription. I'll send it to the pharmacy over there. You can pick that up. They'll also do the referrals for the physiotherapist and the dietitian, so we're looking out for those. Any questions for me, John?
No, you threw another spanner in the works. Okay, thank you very much, sir.
Take care, John.
There you go. Miss Cora?
Yeah.
Hello, come on in. Thank you for waiting.
Yeah, you're all right there.
My name's Dr. Gray.
Yeah.
Nice to meet you. Please
Yeah.
have a seat. So how can I help today?
I got a pain in me back. I'm given the tablets. That's no good for me.
And what have you tried for the pain apart from the codeine tablets?
I take paracetamol.
Have you tried any sort of exercises
I
to
do
stretch the
my
back?
body all the time.
Yeah.
When we go to bed, like stretch me like properly, like and they start. When we stretch too much, we start the pain here.
Do you get any numbness or tingling in the legs?
No.
Any problems passing water?
No.
No.
Another thing, I think maybe something around the stomach or something. Have you had the bowel test? Cancer, bowel test, cancer.
Cancer test?
Yes.
Tell me more about what you mean by that.
Because my sister passed away this last Wednesday.
Gosh, I'm sorry to hear that.
She had a stomach, like cancer.
Gerbax had been very recently bereaved and lost her sister.
Oh gosh.
Mum is scared now.
Was that here? Was she here in Birmingham?
Yeah.
Sometimes patients can be very emotional during consultations, even crying, and as a GP, it's really part of our role just to be there for them and allow them that safe space to express their emotions and be vulnerable, maybe at a time that they haven't been able to do before. So this pain in your stomach, is this new compared to the one in the back?
Yeah.
Okay.
Maybe the problem with the bowel cancer or something in it.
In general, bowel cancer doesn't cause pain as a predominant symptom, but it can cause other symptoms. So I'm going to ask you some more questions. You mentioned that you've been getting constipated with the codeine. Before you started taking this tablet, did you notice any more prone to either constipation or diarrhea?
No.
When you eat food, does that cause you any pain or problems?
Not much.
When you do go to the toilet, does that help with the pain?
No pain that time.
No. Okay. Do you have any blood in the poo when you do a motion?
No.
Any mucus? No.
I don't notice.
No. Okay. Can we examine your abdomen today to see what's going on?
What's the problem like?
Let's see. Yeah.
Mark Land. Hello.
Okay.
Hello there, it's
Hiya.
Dr. Hyder. Come
How
through and
are
have
you?
a seat.
All right. Thank you.
All right, thank you. How are you?
All right.
How can I help you today?
What it is, for the last 5 weeks, I've had severe stomach cramps. I've seen the doctor, I've done samples, stool samples, urine, blood, and then I had an email to say my blood's come back with high white blood cells.
That's right.
So they said there's something perhaps going on there because I keep having hot sweat, so my body's trying to fight an infection. And that's why I come back to the doctors and hoping I could see somebody.
Have you still got the symptoms?
Oh, yeah, it's on a scale of 1, I'm 10 today. It's that bad,
is it?
yeah.
Okay, all right. So whereabouts is this pain?
It's just underneath the bottom of my stomach here.
So the lower part of the tummy?
Yeah.
And has it been constant all day or does it come and go?
Today is the worst it's been. Some days, one morning, probably 3 or 4 days, I woke up and I thought, oh, I'm okay. But then gradually throughout the day, it built up again. And I've lost my appetite. I've probably lost about 6 pounds.
You feel feverish? You mentioned
I have sweats during the day and then during the night as well.
Okay.
And I've got diarrhea as well. It'll last a few days and then things will be okay and then I'll have it again.
Any bleeding from the back passage?
No, I've just checked that.
Let me examine you if that's okay.
Yeah, that's fine.
I think we should be feeling the tummy again because it's painful today, but if it's okay with you, I think we need to do a back passage examination as well.
Fine.
Just lie down on here. Do you want a chaperone with you at all when we do that?
No, I'm on my own today.
You all right? Okay, so I'm just going to start pressing the tummy at the top to start with. And just try and relax if you can.
If you can see the scar tissue, about 25 years ago, I had a twisted bowel.
Right.
So I think they've stitched it to my stomach. So I'm always wondering whether that's playing
Causing
up.
some pain.
Yeah.
That's a good theory, isn't it? Could be. I'm just going to have a look at the back passage area to start with, okay?
Yeah.
So now I've just got some cold gel on the gloved finger and just take a deep breath. That's fine. Okay, there's no blood and there's no lumps, it feels normal.
Okay.
Come back out of the curtain when you're ready, okay?
Okay. Okay, thank you.
So you are quite tender, aren't you, in the lower part of the tummy? The rectal examination feels normal, but you've still got this ongoing pain and we don't really have any answers. I mean, there's lots of different causes of abdominal pain, and because you've had surgery before, it may be along the lines of what you were thinking about there being something called adhesions, where you get scar tissue that can it can attach to the bowels and it can cause some pain. The other thing that's quite common is diverticular disease. Is that something you've heard of at all?
No.
It's when you get little outpouchings of the bowel wall, they sort of stick out inside the bowel, and then they can sometimes get inflamed, or a little bit of poo can get stuck in there and they can get infected. For some temporary relief, we can give you some painkillers to try, but I think we should be referring you into the specialist, which is the gastroenterology doctor, to see what else the cause of this pain could be, and there are a couple of other tests I think we can request in the meantime.
Oh, that's good, yeah.
One is another poo sample to check for any signs of infection, and blood test. I just want to see if you've had iron levels done. I don't think you have, so I think we should do those. And I think the next step is to probably arrange for a scan, an ultrasound scan, to have a look at the abdomen. We can maybe request that while we're waiting for the referral.
Just hopefully, you know, get to the bottom of it soon and sort it out.
We need to look a bit further, don't we?
So I'm just going to feel very gently all over your tummy. Will you let me know if it's painful? Yeah. Any pain there?
No pain.
A little bit there. A bit uncomfortable there.
It's only this end.
Side. But it may be related to your back pain is also on the left, isn't it?
Yeah.
Okay, and deep breath in and out. Okay. It does sound very positional and related to certain positions that you get in, which is much more suggestive of a muscular problem than something that's going on inside the gut. So there's nothing that you've told me today that makes me worried that you have bowel cancer.
I don't want to.
No. I'm going to help you up. We'll still do some tests. All right. That's it. Well done. Well done, well done. I noticed examining you there that it seems to be more the muscles that are tender than deep inside the abdomen. And I think this is more related to your muscles, and it will improve with the physiotherapy that you get for your back.
But so this is after the bowel cancer and thing. You start coming the blood in the toilet, innit?
Yeah, I wouldn't wait. If you had some concerns about what your bowels were doing, you don't want to wait for blood to come, because there are tests that we can do to see blood before you can see it with the eye. It is not top of my list. Bowel cancer would be very, very, very low on my list of what's going on with you today. If I pick up during my consultation that someone is not being reassured by the information that I give them, then sometimes I will consider further tests, as long as they're not very invasive. One test that we could very easily do is just a stool sample test.
That's it.
Because if that's negative, that would be very reassuring. And this is not a screening test, this is an investigation. So you send off a stool sample, I'll give you the pot. It looks for problem in the poo that you can only see in the lab. It's not something you can see with the naked eye. So bring a stool sample for this one, urine for this one, and bring it to your blood test on the 3rd of October, and then it can all be sent off together.
Oh, that's better.
Okay. If you've got pain in your stomach, until we've done some more tests, I don't want to give you an anti-inflammatory medication for your back. So we can try a different type of medication to this.
We try.
Yeah. I'll do it now for you. We'll do the tramadol and the physio. Any questions?
No, be fine.
Okay.
Thank you very much.
All right, nice to see you.
Oh, what lovely chairs.
They're nice, aren't they?
Never sat on anything like this before. Rather exciting.
Pauline.
Yes,
hello.
hello.
It's Dr. Hyder. Come through and have a seat. Hello
Yes,
there.
hello.
How can I help you today?
I've got a nasty personal problem. I've got a lump that's appeared down below. Can I say about 7 or 8 years ago, I did feel a little bit uncomfortable down there, and a doctor did say she thought it was
the start
of a prolapse.
Prolapse is when there is a weakness in the pelvic floor muscles, and this can cause either the bladder, the womb, or the bowel to push through the vaginal wall and can appear as a lump in the vagina. Okay.
I feel heavy.
Does it feel like something's sort of pulling or dragging?
Yes, yes,
Okay.
yes.
Right. Passing urine okay or not?
Yes, I am. Now, normally I could go through the nights quite well, but now I can wake up 3 times in the night, which is annoying.
And have you tried pushing it in at all?
Yes, I have.
And it doesn't stay in?
Oh, no. I'm not aware of anything happening for it suddenly to come down.
It's just happened.
It's just happened.
Okay.
But the last month, it has certainly come right down.
Okay.
Well, I think it's come right.
So you can feel a lump?
Oh, I can feel a lump, and I'm afraid if I put a mirror, it looks like a baby's head coming down.
Oh. be all right to examine you?
Yes.
Yeah. So let's just gently feel your tummy to start with.
Certainly.
Any pain where I'm pressing?
No, not real pain, no. Just feel pressure.
Pressure, yeah, okay. All right. For the next bit of the examination, what I'm going to do is just pop some gloves on.
Yes.
Can you pop the heels of your feet close together and then let your knees just flop outwards a little bit?
Do you know, I remember this from having babies.
Oh, how many children do you have?
Well, I had 3, but my middle son died last year with cancer.
Oh, I'm so sorry to hear that.
Yes, it's awful.
Oh.
But still, life's got to go on.
Oh, that must have been a real shock.
Yes, it was. It was very nasty. But
was it sudden?
Well, after diagnosis, he lasted 9 months.
Oh, my goodness. OK, I'm just having a look at the area to start with, and I can see what you're talking about.
Looks like a baby's head.
If it's OK with you, I'm going to do a speculum examination. You know, like when you used to have smear tests?
Yes, that's all right. Because one always thinks with a lump, you know, could that be cancer?
Other more nasty things
yes,
like
exactly.
Yeah. So just inserting speculum now, so you feel a bit of pressure and pushing. OK. So you can get dressed and come back through.
Yes.
And do you need a hand sitting up, or are you?
Come OK. Come out this way.
Yes, you come and have a seat.
Excuse me.
So, yes, it is definitely a prolapse. That's what it looks like. Okay.
Yes.
Now, there's different types of prolapse women can get, and one of them is the front part of the bladder pushing down, and that's what you can feel. That's the lump, and I think that's why it's causing your urine symptoms as well.
Yes.
There's a few different ways to manage things. One of them is to try a ring pessary, but I'm not sure how helpful that's going to be because it's coming quite far down this prolapse now.
Yes.
And with the urinary symptoms, I think it's probably best for us to refer you to a gynaecologist if that's okay with you.
Fine, yes. I'm happier at your diagnosis than what I thought it could have been.
Right, so you had in your mind that it might be something more worrying like a cancer?
Yes, but yes, I did.
So a bit relieved that it isn't something more worrying.
And, you know, just go with it and see what they can do for me.
Yeah, sure.
Thank you very much.
That's all right.
Everything was very nicely done, thank you.
Oh, no, that's okay. You take care.
I can go back with a spring in my step, actually.
Bye.
Bye-bye.
Why'd you leave Australia?
The weather, obviously.
Wouldn't get no better in Australia.
I know winter's coming.
Winter.
Everyone's wearing 9 coats.
If it rains, is football cancelled?
If it's like proper going, yeah. But if it's like a couple of drops now.
It's okay, isn't it?
A brisk walk. It can be harder going into the winter. Put some layers on.
Okay.
Waterproof coat.
Okay. We're trying to get out into the garden again. It gets too wet.
Sun looks like it's trying to peek out for this afternoon, but...
I shouldn't hold your breath.
No.
Mr. Morgan?
Yes.
Hello, come on through. Can I come?
Thank you.
Of course you can, if you're happy.
Yeah?
Yeah, there's room for both of you.
Okay.
Come and have a seat there. My name's Dr. Gray.
Hello,
Hello
Doctor.
there. If you take a seat next
these are posh, aren't
to John, aren't they nice? How can I help today? John?
I'll let my wife explain.
Okay.
Because she's been treating me, son.
Okay.
He's got, turn round and let's, he's got, I don't know whether it's a boil or an abscess. Just turn to me, John, so that I can, but you see, I'm having to keep covering it up because when he's in bed,
yeah,
or when he pulls his pants up, it's on his waistline.
How long's it been there for, John?
Nearly a fortnight.
Okay.
And a lot of yellow stuff keeps coming out.
Is it sore?
No, just
Do you mind if I
doesn't
pop it
hurt
off?
at all.
Yeah.
No.
How did you notice it?
Me.
Okay.
Now, when I took the plaster off this morning, it was full of yellow stuff again.
Okay.
And I don't know what to do with it. Yeah, you see, I push it like that.
Yeah. I'm just feeling it underneath the skin, John. I'm just seeing how big it is.
Yeah.
It's quite small and there's not lots of fluid underneath. So how much fluid comes out when you touch it? Or on the
Not
dressing?
so much now, but quite a lot used to come out. Years and years ago, John had this little lump. And we went to the doctors and he says, oh, it's nothing to worry about. It's probably a little cyst. It might in the future fill up. I'm talking about 20 years now.
Ah, you can have a seat. Sit down again, John.
Okay, thank you.
Come and have a seat. Your wife's been taking very good care of that.
Oh, thank you.
So there is just a little a little boil under the skin.
Is that what it is?
Yeah, it's just a boil and an abscess is the same. It's the same term.
I did.
Yeah.
Don't know the difference.
Staphylococcus, is it?
It is often Staphylococcus that causes it, and it's a little pocket of pus underneath the skin. It often starts off as a little cyst, and they can get infected. Now, sometimes they're big and angry and red and sore, but because you've been keeping on top of it, it's very manageable. But it's been 2 weeks now, and as you say, it's continuing to discharge some pus.
Yes, and I said to him, "You've got to go somewhere." I might be all right, like men are. And because you can't see, you don't really know what's going on.
Were you ever unwell with a fever with it?
No.
Or feeling sick?
No.
Okay. And have you ever had any other infections on the skin?
No, not really.
Like that. Okay.
No, it's just that, but I want him to get it cleared up.
Yeah.
So
I think the answer to get it cleared up is a course of oral antibiotics.
Oh, right. Yeah. Yes.
Because if it's been 2 weeks and it's still continuing to ooze,
yes.
Then it just needs a course of antibiotics to clear it completely. If you feel that it's nearly there after 7 days but still isn't completely healed, contact the surgery again, and sometimes for skin infections we do give a second course.
Okay.
I think you're doing the right thing by putting a plaster on it, particularly where it is, and I would just change that regularly.
I do,
and then it should scab over and it should be fine. There is another option here, if it's with the way that you describe the trajectory of the improvement, is you could just hold off for another 48 hours and see if it just, that last bit of healing does it on its own.
Yes.
You could hold on to the script of antibiotics and only start it if you don't see that ongoing improvement.
Oh, that's lovely, thank you.
Right,
thank you.
So I'll send that to the chemist.
Oh, thank you,
All
Doctor.
right.
Yeah, that's lovely.
Lovely to
thank
meet you both.
Hang on, we've got to get up.
Yeah. Do you need a hand?
Yeah.
Yeah.
Cheers.
Fantastic.
Lovely to see
and
you.
you too.
Thank you very
Have a
much
nice
for your help.
afternoon.
Thank you very much.
Take care. Bye.
Thank you.
We've got to get off this chair.
Are you all right? Let me.
Yeah, no.
Do you need help?
Yeah.
Nice to see you.
Thanks for giving us time, sir.
Jolly good.
Sit, done it. Oh, thanks ever so much. Could I come to you permanently?
Of course.
Thank you very much,
That's
Doctor.
all right. You take care.
You've eased my mind.
Oh, take care. Bye-bye.
Thank you.
Thank you. Have a lovely day.
Very good.
Thank you.
Thanks for cooperating.
Thank you.
All right.
Thank you so much.
No problem.
Very nice to meet you, Doctor, and
No problem.
I will pray for you tonight.
Oh, that's very kind. Thank you.
The people of Birmingham have been lovely, they've been really welcoming and friendly to me. The thing that struck me the most, though, was the patients in terms of actually how similar they are in terms of their wants and their expectations and their, what they hope to get from their doctor, because I think that's probably a commonality we share across the country.
Okay, good night, Oscar.
Good night, Dr. Ferdinand.
Have a good evening.
It feels like there's a hole in my back.
Have you noticed a lump round here?
Not really, no.
You may also be becoming dependent on that medication.
I'm pretty sure that's already happened.
We do need to get you into hospital today.
Today?
Yeah.